by technology, hearing us wherever you are, and thank God for each one of you here this morning and how beautiful you look, and I want to thank God for each one of you. We cannot say enough to be safe and no gathering and so forth, and you are to distances. Thank you so much. I want Dr. White, our medical staff, to come down and just take a moment again to keep on encouraging us. We just cannot be safe enough. You take a moment and just encourage us. We're just so delighted at Elizabeth Church family. We have so many medical professionals, members of this church, and that is Dr. White's field, and he's going to just encourage us because we cannot say enough. Be safe and pray for all of those who've been affected by COVID-19. Most of all, God is able to heal our land. Bless you.
Good morning, Pastor Swift, and thank you again for giving me this opportunity to speak to you. My heart continues to be heavy as we see what the devastation that COVID-19 continues to do in our communities, around our state, and in our country. This week, our hospital reached another milestone in the number of cases that we had presently, in the hospital at any one time. And now we have surpassed that number this past week. We continue to have patients in our ICUs, on ventilators. We have people on BiPAP getting high concentration of oxygen, and people are dying every day. It's true. The number, the things that you see around the country on the news is, it's true here in our community. So those who are thinking that, oh, this is not true, it's not going to affect me, please reconsider. I thank the pastor for stressing us following the CDC's recommendation here in church, wearing our masks appropriately, keeping our distance, not congregating after church, not all the hugging and handshaking and all of those things. We should continue to do them. Now, as the holiday season comes around, I know we're all, tempted. We just had Thanksgiving, and we do things traditionally all the time, and having families and meals, and then I hope that some of us were able to reconsider and not getting together and not being so close. So Christmas is coming too. And again, let us stay alive to see another Christmas rather than trying to force this thing to happen and, having people coming from all over the places. And if we're not able to be outdoors and spread apart and all of that, just let's not do it. Let us continue to be vigilant. The flu season is here, and I mentioned to you all, encouraging people to get the flu vaccine and all of that, and I hope that you all, continue to do so. And in our facility, we're not seeing as many flu cases at this time of the year as we have seen in the past, and I think it's because of all of this that we are doing. But if you get them together, flu and COVID-19, it will be a bad thing to happen. We've all heard about the vaccines, and I told you all that vaccines are coming, and that when we are convinced that the vaccines are okay, and we're going to be able to take it, we'll do so. And I'd like to tell you now that I've made up my mind that I am going to take the COVID vaccine. I would take my chances with the vaccine, then take my chances with COVID-19. COVID-19 is devastating. Whether that vaccine is 40%, 60%, 90% protective, I would prefer that than to not have nothing. And if I'm going to contribute to the herd immunity that we talk about, some people think, oh, you get infected and then you get a herd immunity. That's a better way of getting herd immunity, by getting vaccinated. I don't think there's conspiracy out there trying to make vaccines cause you all this trouble or whatnot. I doubt that. I'm just convinced that is a better thing to do than to risk getting COVID-19. So when the vaccines become available, they say, the healthcare workers, the frontline people, nursing home people, they're going to be the first ones. Yeah, the amount that we're expecting to get in our community is not enough even to meet those people's demands. But we have assurance that we will get enough vaccines, and as the spring comes in, and so more and more people will be able to get vaccinated. So if the opportunity arises for you to be vaccinated, please consider doing so. I rest my case, Pastor. Thank you.
Thank you so much. God bless you. Thank you so much. And we're going to take precaution.